Hello. Thank you for joining us for a live conversation about the coronavirus and COVID-19 vaccines in Idaho. I'm Audrey Dutton, health and investigative reporter for the Idaho Statesman. We are now a year into the pandemic. The governor has just advanced Idaho farther into reopening, and we're waiting to find out if a more infectious variant of the virus has been circulating in Idaho. At the same time, thousands of Idahoans are getting vaccinated against COVID-19, but many, many more are anxiously awaiting their turn. We're fortunate today to have two experts in Idaho healthcare here to help us make sense of what's happening. Dr. David Pate spent a decade leading St. Luke's Health System, the state's largest healthcare provider. He now helps advise Governor Brad Little on Idaho's pandemic response. He blogs at drpatesblog.com, and you can find him on Twitter at drpatesblog. Dr. Tommy Ahlquist is a former ER doctor, the CEO of BVA Development, and the co-founder of Crust the Curve Idaho, which has arranged COVID-19 testing for businesses and the public since early in the pandemic. He's on Twitter at Tommy Ahlquist. Thank you both for joining us.
Glad to be here.
Thanks. We have received more than 100 questions, and they've been coming in like a ton this morning from Statesman readers. So we're going to dive in soon to start getting those answered. And please, if you have questions, leave them in the comments of this video's live streams on the Statesman's Facebook page and on YouTube. We are monitoring them live. First, though, I would like to ask a question. What grade would you give Idaho so far on how well the vaccine rollout has gone compared with how other states are doing? Dr. Pate, let's start with you.
That's a tough question. Obviously, there's opportunity for improvement, certainly. The problem is that so much of this is not exactly in the state's hands. But I guess if I was forced to come up with a grade, I'd give it a B or B minus.
What do you think is going right and wrong?
Well, I think I think what is going right is the amazing efforts by healthcare providers in the states. St. Luke's, St. Al's, Primary Health Medical Group, Salser Health. All of these providers have taken on a Herculean task, and they're doing it for everybody, not just their patients. So they don't really have to do that, but they're really stepping up. And I would say, they're a big part of what's going right. The other thing is, I would commend the vaccine committee. There's nobody that agrees with every decision they've made, and they've had to make hundreds of decisions, but somebody had to make those decisions. And I would quibble with some of those decisions, but these are largely people who took time out of their daily lives, their jobs, their day jobs, to spend time on this committee and help come to these very difficult decisions about prioritization. So I want to commend them. I want to particularly call out Dr. Patrice Burgess, who's chaired that committee, Dr. Dave Peterman, who's been an important part of our vaccine effort and on that committee. So those are some things that have gone well. What hasn't gone as well, a lot of it is related to the federal government. They've, when they were, Operation Warp Speed, which I do commend them for a number of things. I also criticize them for a number of things. Even if they felt their only obligation was just to get vaccines to the state, anybody in that position is going to know and should have sounded the alarm that states aren't ready for this. States don't have the resources for this, and more should have been done to help equip states to do this. The second thing has been there hasn't been enough transparency. The state and the healthcare providers too have been having to react within a week or less's notice that what vaccine they were expecting is going to change. We shouldn't be changing that on that frequent of a basis, and it just makes it hard for states and for healthcare providers to plan. So the lack of transparency, even how have they determined our dose allocation, which is among one of the lowest in the country? So how did they determine that? There hasn't been a lot of transparency. And of course, they missed opportunities. There was an opportunity for the Trump administration to buy 100 million more doses of Pfizer vaccine, and they passed that up. I don't understand it. Maybe there was a good reason, but I can't think of one. And so, I think there's been a lot of problems, and I think a lot of those problems come to federal state coordination. You got to work together.
Thank you for that answer. And just to real quickly fill in our viewers, the committee you're referring to is the Coronavirus Vaccine Advisory Committee. And
Correct.
That is a group of, I think it's more than 30 people, maybe, representing all sorts of stakeholders and groups. And so they've been tasked with figuring out the details of the rollout, who goes first, who goes next, really, really down to fine detail. And Dr. Ahlquist, I'm interested to hear what you think. What grade would you give Idaho relative to other states?
Yeah. So first of all, I agree with so much of what Dr. Pate just said. The effort, I get the chance to talk to some good friends that are in the middle of this, and there is no shortage of effort and desire and people that love Idaho and want to do the right thing. And I think that's what makes your question so hard, is because it's not hard to give yourself a bad grade based on results when you're trying so hard, especially when so many things are out of your control. But I got to be honest, we got caught flat-footed when the pandemic hit us last year, as a state, as private industry, as a country. And I think everyone kind of did their best and with testing, but we've known a vaccine has been coming for months, right? We didn't know when, but we knew it was coming. I'd give a D-. I think it's been, I think all of the things we're experiencing right now, systems crashing and what are we going to do next? And it's not because people aren't trying hard, it's that we're not prepared. And I would have hoped we would have been more prepared. I think you hit the nail on the head a little bit, David, when you said, we've got our health systems. I think, Chris Roth and Odette at St. Al's, they're working day and night to make this thing happen, but they're also taking care of their patients in an ER and an ICU. They're also taking care of everyone else that's sick and their own employees. So somehow to think that they were going to be the total solution to this it just wasn't going to happen. And then I've said since beginning, I had the advantage to go visit all of the health districts around the state. They were underfunded and underprepared for a pandemic. I thought we learned a lesson with contract tracing and with testing when we pushed everything down to them, and that failed miserably in Idaho. So to think that you could do the same thing on a vaccine distribution, that we wouldn't have technology that is readily available, it's out there right now that will allow patients to essentially log in with a unique identifying number and then put in a queue and then work with these healthcare providers, pharmacies, or whoever else to then get those patients out. But we're in a bit of a mess. Now, I think we're going to get out of it. I believe in Idaho, and I think, we're going to get out of this thing, but we knew that the amount of vaccine we were going to get was dependent upon the amount of vaccine we were going to get in people's arms. So to somehow pretend that wasn't part of the equation, I don't think that's accurate. We needed to get the vaccine out so we could get more. And then there have been, listen, David, I agree with you completely. The federal response to coronavirus has been just pathetic. I don't know how it could have been worse. And even though the promises of the vaccines that came out through the Trump administration and what they were doing, and certainly they did some things very, very right with the vaccine production, but boy, there's just been no support, and it keeps getting pushed down. Then unfortunately, who suffers are the people. And but again, I'm very optimistic that with as hard as everyone's working, that we come together. Just a quick, whenever this happens, let's say it's a B that David said or a D- that I said, you have two options. You can sit and make excuses, and I think that's what I'm tired of. we can't make any more excuses. It is what it is. Let's come together. Let's figure out solutions and let's go forward. And I think that's what I'm seeing happening in the community. And I have a lot of hope that we're going to figure this out and get some mass testing sites up, get some more vaccine, have a more coordinated effort, try to not overwhelm our systems while we're doing it, and get out of this. But we need some work. We need it now.
Great, thank you for that answer. And I would just point out that, a lot of other states have dealt with some of the similar issues that we've had, and there are states that have approached things far differently. A lot of states, though, are in very much the same boat that we are, and it seems like it's because the rollout systems are all terribly fragmented. The coordination between federal, state, and local, and the reliance on the ground providers to make a lot of to do a lot of this has been really a struggle for our country. Many people asked, came from a lot of readers, have asked why the state hasn't rolled out the vaccine to people with high risk health conditions. That decision is ultimately made by the governor with input from the Vaccine Advisory Committee. But I'm wondering, what are your thoughts on that? Let's start with you, Dr. Ahlquist. What do you think of not offering the vaccine specifically to high risk health conditions?
So first of all, when you look at the role of that committee, it's very difficult, right? Because everyone wanted it. And so they're going to have to make choices. For me personally, looking at who was at risk and who was hospitalized, it's hard for me to not say, hey, I wish high risk people were getting it earlier. I also, frankly, one of the things I can't not say today is I'm disappointed by how many people are jumping in line and how it's all working, who's getting it, the state's not tracking it. I worry about disadvantaged populations. I worry a lot about poor people that have health conditions that don't have good health care to begin with, and now they're the ones that should be getting this vaccine early on. There's a lot of things to worry about, but I certainly, my vote would have been to put that group as a priority. But again, I know, and David will have a better answer than I do because he's more on the inside. There's probably a lot of other competing interests that drove those decisions the way they went, but certainly would have been higher on my priority list.
Dr. Pate, what do you think?
Yeah, I agree with everything that Dr. Ahlquist said. I think that I wasn't part of the Vaccine Advisory Committee. I wasn't part of those discussions, so I'm not privy to exactly what their thinking was. I can certainly guess, but I think that the problem is we're getting, back earlier, we were getting about 20,000 doses a week. Now we are getting up close to 25,000 doses a week, but that's not very much. And so if I were on the Vaccine Advisory Committee, I would say, okay, what is going to be our decision-making framework? Because I think there's several ways you can approach this. And when I say a decision-making framework, I mean, instead of just, whoever lobbies us the most to say, where we're going to rank them, what is the objective? And I can think of three objectives that would all have merit. One is, like Dr. Ahlquist is saying, let's decrease the disease burden. In other words, let's make sure that we reduce hospitalizations, reduce deaths, reduce the pressure on the healthcare system. If that was your objective, then the people you would vaccinate first would be those over 60 and those with accompanying medical disorders, even if they were younger, multiple medical conditions that put them at high risk. So that would be one way to approach this. Another way you can say is, let's actually take an approach of decreasing transmission. What we want to do is decrease the spread of this disease. And if you were going to do that, then you would prioritize people that are 20 to 40 because they seem to be really driving the spread. A third way you could say is, let's preserve our infrastructure. And if you do that, then you're going to prioritize those people that you have to depend on: healthcare workers, grocery stores, pharmacies, transportation, police, fire, EMS. So what I think, and as I said, I think all three of those have merit. I think what the committee did, again, I'm not privy to their discussions, but I think they said it's pretty hard to decide which of those. And I think they tried to do a combination of those priorities, especially the first and the last. And when you do that, you do get, when people outside of the process are looking, they're going, this doesn't make sense to me. I don't understand. And certainly I had a lot of elderly friends, telling me, I'm locked up in my house and I'm watching people half my age get vaccinated. And it's because they didn't understand. And I think when you talk about things we could do better, and let me just amplify a point that Dr. Ahlquist said that is critical. Just as he said he thought we would have learned before, we have to learn from this pandemic. And I hope when this is all over, we do a very deep dive on all aspects, federal government, state government, public health, healthcare providers, everybody. What do we need to do differently next time? And let's learn from this.
Yeah, those are all really good points. And I've watched the Coronavirus Vaccine Advisory Committee meetings, and boy, they have a lot of questions that they have to answer every time they meet, every couple of weeks.
Yeah.
So I want to jump into start with some reader questions. We got some really, really, really good ones. This one is sort of along a similar theme to what you were talking about, Dr. Ahlquist. Two readers had really good points that they made, but I can't tell you how many people have asked me about this. Clive from Boise said, it makes no sense to leave the process to chance by having everyone repeatedly checking websites in the off chance an appointment will become available. Sue from Ketchum points out that every vaccine provider gets a different number of doses and takes their appointments differently. And she asked, why is there no coordination between vaccine providers? Wouldn't a central list be most efficient, where each person in a community gets directed to the first available appointment in their area? And I know that the state considered using a website, I think it was called PrepMod, to do that. And they opted against it because they thought it would be duplicative of what the local health districts were doing. But Dr. Ahlquist, what are your thoughts on that?
So I think PrepMod is failing. The interesting thing about Crush the Curve is we're working a lot with Massachusetts. We're doing a lot in Tennessee. We're doing a lot in Texas. We're helping other states with the same problem. What we found with testing is everyone had plenty of testing until you needed testing. And as soon as you needed testing, there wasn't any testing. So what we did at Crush the Curve is we spent a lot of our time and effort putting together software that basically connected a patient with a test, but it was agnostic that who ran that test. So it basically matched up capacity with labs with patients. We easily could have modified, and we actually proposed to the state, why don't we just use this same HIPAA compliant system that we already have that's agnostic to healthcare providers, basically based on your zip code. It would send you to a provider that had capacity and vaccine. It would auto email you back and tell you where you are in line and where you're going to get hooked up to a vaccine. We proposed that a few weeks ago. I think it would have worked. We're actually working with Massachusetts today to try to implement that in the state of Massachusetts. So it's out there. I mean, there's things out there that we could have done to get people up. We're launching today at Crush the Curve. So if you go to vaccinate208.com, we only have 9 full-time employees, by the way, and we have someone calling clinics every day all around the state, and you can you can click on your region and it'll list all the providers, and then we're calling those providers every day to at least give the public updated locations where there's vaccine and what we're hearing, and we're doing our best because it's a mess right now, right? You've got people double booking, you got people, I mean, I don't know how many people call me every day saying, hey, how do I do this? How do I do this? I said, I have no idea. But all I can tell you is you got to get online every morning and try to get an appointment. That's just, I mean, listen, the 90s called and they want their technology back, right? Like the next thing we're going to do is roll out a rotary phone that maybe you can, I mean, I don't understand why with 8 months, we didn't know that we were going to overwhelm every system with people calling. So there are solutions out there. I'm super hopeful we use them. If not, we'll muddle through this and it'll take us 10 or 12 months. And if we figure it out, we'll do it a lot sooner. But I feel bad for people because here's my thing. Unlike a health system at Crush the Curve with our little board, we get up every day and say, how can we be helpful? And we have people hurting. There are people that have been waiting for this for 8 months. They're just so anxious They want the vaccine. They know they need the vaccine. They want to see their families. They have a comorbidity that they're worried about. And my goodness, Audrey, you know this, it's emotional when you talk to them. They're like, please help me. What can you do? And that's why I'm hopeful that with testing, you kind of really couldn't judge what was going on. You couldn't. I mean, you could ask different questions. Everyone had there was a million different theories. And with the vaccine, all you need to do is go to Becker's Hospital Review every day, and you can see what every state's doing, how they're vaccinating. You can hear how they're, mass vaccinations. Everyone's figuring this out. And I believe that scoreboard is going to drive Idaho to do some really good things in the coming months, and we're going to come together. And I'm going to say one more time, listen, Chris Roth, Odette Bolano, Dr. Pate, there are people that are committed to this, that are spending 16 hours a day trying to help figure this out down at the lower level. But we need help from the other levels because, you know the saying, Audrey, it all rolls downhill. And that is true. With COVID, we have proven once and for all, it rolls downhill, and it's not very fun to be the guy at the bottom, and they're working their tails off.
Yeah, Dr. Pate, do you have anything you'd like to add to that?
Just had to find my unmute button. I totally agree with Dr. Ahlquist. We have seen over and over and over again through this pandemic all the limitations we have concerning technology. And it's not that there aren't technology solutions. We just don't have them. And it gets back to his previous point about we have to learn how to do this better. One of the reasons that we and so many states are struggling, aside from what I agree with Dr. Ahlquist, a totally inadequate federal response, is the fact that states have continuously tried to ratchet back their budgets. And so, after we learned how to purify water, after we learned how to handle food safely, after we had the emergence of antibiotics and so on, we just quit. All states consistently decreased the investments in public health. And so our public health infrastructure is not robust. It's not supported. And all you need is a pandemic like this to show you that we don't have the resources that we need. And I hope we learn from this, because there's some people saying, oh, well, who could have imagined we'd have this pandemic? Well, every scientist, every doctor, every healthcare administrator, we've been planning at our small levels for 20 years for this. So we didn't know it was going to be January of last year. We didn't know it was going to be the coronavirus, but we knew it was coming. And yet our governments, state and federal, were not making the necessary investments. So I do hope that we do what Dr. Ahlquist is talking about and develop more robust information systems. I get a kick out of the fact, we're the United States of America. And guess what? If you want to follow the data, and you know this, Audrey, because you're following it. If you want to follow our data, you can't trust, you don't know what the data is over the weekend, because everybody's off for the weekend, right? We've got a pandemic and everybody's off for the weekend. So we don't have numbers. And then you check them on Monday or Tuesday, and then they go sky high because now everybody reports. We've got to find better ways. And what we've done as a consequence, just like Dr. Ahlquist said, because we haven't invested in public health, we're pushing this all on healthcare providers. And we're saying, we know public health's not your job, but we need you to do this. And it's a lot. And I'm glad they're stepping up, but we need more.
Hey, Audrey, can I add one thing to that? Listen, me and Dr. Pate will be the first to just sit and say, hey, federal government, what on earth were you doing? The misinformation, the whatever. But I could not wait for this legislative session to start, because I thought, finally, we have this beautiful chance in Idaho to have legislators who must be listening to their constituents. They must come to town and say, hey, what are we going to do to help solve this problem? We know that these 7 local health districts are in shambles, that they weren't prepared. What are we going to do to be part of the solution? And I'm telling you what, I can't even watch, because it's the most disappointing thing. It's not even talked about. It's not on anyone's agenda. And instead, they're dealing with all this baloney that has nothing to do with people. And we're in a pandemic. So if a pandemic and people suffering in your own district is not enough to get a local legislator to literally pay attention for 5 minutes to something that matters, I don't know what we're going to end up doing, because it needs to be a total relook at their governance, how they work, how they flow together. It needs to look how they're funded. I mean, it was always a problem before, and just how we handled Medicaid in the poor population before in Idaho, it showed that glaring weakness. How we handled immunizations before, it showed that weakness. And now all of a sudden, in the middle of a pandemic, they're here, declaring that it's over and marching on. And who knows what they're doing? But we've got problems. And I would say anyone listening out there, pay attention to local politics, and we got to get some of these circus clowns out, because it's hurting our people, and they dominate. They suck up all the oxygen, right? So even if a good idea is there, the clowns are sucking up the oxygen, and that's the state we live in. We need to pay attention, and we need to pay attention now, and let this pandemic be an example to us just how bad it is. Sorry.
And let me give an amen to that. But it's even worse than what Dr. Ahlquist is describing. He's describing the fact that these legislatures aren't even paying attention to these issues and addressing these issues, which is absolutely true. That would be one thing. They're actually trying to figure out ways we can make this worse. So they're trying to take away the emergency declaration, which is just about the craziest thing I've ever heard, because that is going to hurt Idaho and Idahoans. And then we have the brilliant idea that, what the answer is, to this bad pandemic. Let's just not have any restrictions. Let's just everybody go out and get together in big groups at the same time that we know these variants are coming. It's just absolutely terrible. And I do hope voters will hold these legislators accountable.
Thank you, both of you, for your thoughts on that. And I do want to kind of talk a little bit about, this is something that several readers have asked about, the vaccine hesitancy and the reluctance to see COVID-19 as a public health issue, because it does seem like in some situations, the legislators who are proposing these things don't see it as big of a threat as you do. So one of the questions that we've gotten from a couple people, from Joseph in Boise, who asked, what do you say to a doctor that is telling patients not to get the vaccine? I have heard anecdotally stories about healthcare providers in the state, downplaying COVID. Greg from Boise asked, there seems to be a deep mistrust of science in Idaho. Many people neither mask, distance, won't be vaccinated. If so many aren't listening to doctors and public health experts, who are they listening to form their beliefs? What information is being presented to them to have such distrust? What institutions in particular are responsible for spreading this agenda? And I'm curious what your thoughts are. I mean, this is something that's been an issue that's been brewing for quite a long time, but this seems to have brought it to the forefront. Dr. Pate, what are your thoughts on that?
Well, quite a few. You've packed a lot in there. So first of all, let's talk about vaccine hesitancy for a minute. And there's no doubt that's a problem. And one of the problems is there's not really been a lot of federal support to states for messaging. And in fact, the federal government coming up with effective messaging to get out there about why we should be trusting this vaccine. With that said, let me say that I don't think the vaccine hesitancy is going to be as bad as a lot of people are projecting, for a couple reasons, several reasons. Number one, some of what right now seems to be vaccine hesitancy is not that people are saying, I don't want to get the vaccine. People are saying, I want to wait a little bit. I just want to see more people get vaccinated and realize that it's okay. And then I think there'll be a lot of people coming in, jumping, this spring, wanting to get vaccinated. The second thing about that is that I do think people are very, very mistaken about where we are right now. I think there's a sense that, we're on the downhill side here, the home stretch. Our cases are coming down, the hospitalizations are coming down. We're starting to get people vaccinated. I think people are in for a rude awakening come March or April, because when those variants get here, last year we didn't have a whole lot of previews of coming attractions. We've had a preview of coming attractions on this one. You just have to watch the UK, Ireland, Denmark, and see what's going on there. Now, if somebody can tell me why they think we'll be different from them, okay, but I can't think of a reason why our experience is going to be different. And what's going to happen is our cases are going to shoot way up. And I think that when people see, oh, this really isn't under control, this really isn't going away, I do think, again, more people will want to get vaccinated. There's much more I could say, but let me just conclude with this thought. Part of this whole problem on our public health approach, and public health has to be based on trust, and it has to be based on science, and it has to be. You need leadership, and with leadership comes role modeling. And I have to say, we have had an abysmal leadership. There are certainly some examples of good leadership, but we have at the federal level and then in our legislature. I mean, here we are a year into our pandemic. Our legislature can't wear masks in the Capitol. So what message is that sending? I mean, they are undermining our public health efforts. And I know there's those that say, it's not that big of a deal. Let's just keep old people locked up at home, but let's let everybody else get along with their lives. Well, guess what? When you do that, you get lots of transmission. And guess what happens when you get lots of transmission? You get variants. And guess what? Eventually, we're going to get a variant that is going to be a big problem for us. So what we all need to be doing, regardless of your views about this virus, you need to be helping us get control of this, or it is not going to go away, and it's only going to keep evolving and get worse.
Dr. Ahlquist, do you want to add anything to that?
Yeah, I would love to, Audrey. So first of all, one of the most confusing things in my lifetime will be thinking back to how this pandemic rolled out and how pro-business, I mean, we have multiple small businesses. We want our kids in school worse than anyone. Believe me, having them home is not, we want our kids in school. We want to stay open. We want our business to thrive. We don't want them to go out of business. Pro-business, let's stay open. So for me, and as a physician, it was so clear in my mind, boy, if we're all coming together on this and reducing transmission and following precautions and doing what we can do, we're going to stay open. It was comply to stay open. And then this freedom thing of don't tell us what to do came in. And frankly, as a physician, I'm sure Dr. Pate would agree with this. It was pretty odd because we're pretty used to sitting down with a patient in a room on a stool and looking him in the eye and saying, hey, I care about you and your family. And this is what I would do for you to be healthy. And your whole career, people are looking at you back in the eye and saying, thank you. That's what I'll do. And for the first time in a long time, they would look you back and say, oh, you're wrong, because I read this or Trump said that, or a legislator told me to just snort oregano and it's going to go away. I mean, there's some things that have happened that are new. Okay, so then take that. It makes you very frustrated because what you want to do is say, "Are you kidding me?" We should never say, "Are you kidding me?" We need to take the people that have hesitancy, vaccine hesitancy, very seriously. They have been told lies. They've been told things that are just not true. And if you just say, I'm right, you're wrong, you're never going to come together. And what I've found, even on my own in the last several weeks, if I can sit down with someone and say, listen, here's what I understand about the science. I want to stay open. I want to thrive as a family and as a community, but these are the things that we do. And you really talk through it, you can get at a pretty good spot. But it takes a while, Audrey, because there's so much out there now with misinformation on the internet. And then, frankly, really bad people who are phonies and frauds pushing bad information for political gain, we're up against just a tsunami of bad information as medical providers saying, no, listen to us because this is the science behind it. This will help all of us. But I think it's calm, it's understanding, it's looking him in the eyes like you would a patient, it's bedside manner, it's trying to get to a common place of understanding, and then you get somewhere. But we need a lot more of that in our community. And I agree with Dr. Pate completely, 100%. That's why, hey, listen, that's why I love Dr. Pate. I follow along, and I don't know how many hours a day he spends like putting time in trying to answer questions on the different platforms. But God bless him, because he's just patient and he listens to people. And we all need to sprinkle some Dr. Pate on us and be patient and listen to people and try to get some understanding. And even when we do that, we're going to have some batshit crazy stuff out there to deal with. But patience and understanding.
Dr. Pate, this question is going to be for you. We got a lot of questions from people who trust vaccines in general, but are nervous about this one. So Barb from Meridian said, I'm 78 years old, have a strong immune system due to diet, supplements, and exercise. I have taken every vaccine recommended, but I'm skeptical about the COVID vaccine. She wondered about the immune response. As we know, one of the kind of, it's not really a side effect, but people are experiencing an immune response. They might have fever, headache, fatigue, things like that. So she wonders about that and wonders whether the vaccines themselves, particularly with a second dose, booster dose, and then if we end up needing more in the future to deal with the variants, she worries about whether that could overwhelm her immune system.
It's a very good question, but I would tell her that she should definitely take the vaccine, and let me explain why. This is not the only vaccine to cause some significant reactions: sore arm, swelling, pain, rashes, a number of fever, a number of things. She likely has gotten the shingles vaccine, and I'll tell you, that's the roughest vaccine I've ever gotten. So a lot has been made of these effects, but what these are the effects of your immune system responding in a very healthy way to this. Every study that we have about vaccines, where they are given, they rev up the immune system, and so she's been taking very good care of her immune system. But the plain fact of the matter is, just based on her age, even if she has a great immune system, she's going to be at increased risk. And she's exactly the kind of person who's, otherwise doing everything she can to take care of her health, that we need to protect her. My mom, 20 years older than me, she just got her vaccine, and I encouraged her to get that. So I'm not just saying this to people, we're doing it. The minute that I can get the vaccine, I'm getting it. And so the side effects that you get, they're not fun, but you should actually take solace in knowing that means your immune system is responding. The only people that we have concern about with this are people well into their 80s who are very frail. We have seen that it can be too much for them, but that's not what she's describing. She's a vigorous person in her 70s. Definitely encourage her to get the vaccine.
And of course, we're only referring to the vaccines that we have available through the FDA's emergency use authorization right now. There are other vaccines in the pipeline that may eventually be coming to Idaho, but and they might have different efficacy levels at different age groups and things like that. But right now, all we have is the Pfizer and Moderna. Dr. Ahlquist, is there anything you wanted to add to that? No.
Amen.
One other question, this has come up a lot. mRNA. If you take an mRNA vaccine, does it alter your DNA or interact in any kind of way that would harm your your genes. Can you answer that, Dr. Pate?
Yes, and it does not. So let me just explain really quickly. Your genetic code is in DNA, and that's in all your cells, every cell of your body. What happens is DNA tells your body how to make things that give us our characteristics. And one of the things is it has a code that says, here's how to, if you need to make this protein, here's how you do this. If you need to make this protein, this is how you do this. And the way you get the message, because the DNA is in the center part of our cells called the nucleus. The machinery that makes our protein is out in the outer part called the cytoplasms. And so you've got to get the message from the DNA to that machinery that makes the proteins. The way we do that is through something called RNA. And RNA, all it does is it transcribes this. So for example, you may be transcribing this video cast. I don't know if you are, but if you are, it is possible that transcription is going to misunderstand a word that Dr. Ahlquist or I say, and it might have something different. So you can have some errors in the RNA, but you don't get, it doesn't do anything. So even if there's a mistake in that transcript, you can go back and look at the video, and what Dr. Ahlquist and I said doesn't change just because there's a typo there. So the same thing with the mRNA. The mRNA just reads that part of the DNA to get the instructions and then carries the instructions to the other part of the cell. So mRNA does not alter your DNA at all. And it's actually very safe because it doesn't last long. In fact, one of the things that why it's been actually kind of difficult to handle these first two vaccines, which are mRNA vaccines, is because mRNA is so fragile and it can be destroyed very easily, and it will be destroyed in your body. It won't last very long, but it will last long enough to take that message of, hey, what we want you to do is just make some of this protein that we see in the coronavirus so that it stimulates your body to say, uh-oh, let's attack. And so it's a very safe way. And in fact, now that millions of doses have been seen, we continue to see this is very safe and does not cause a problem. So there's no need to be concerned about that.
Great, thank you for addressing that. Dr. Ahlquist, I'll ask you to answer this one first. From Mrna in Boise and a lot of other people wondering about, if I'm vaccinated, but someone else isn't, or they're vaccinated and I'm not, what is safe? So Mrna asked specifically, what's the best practice for quarantining, masking, and so on for visiting with vaccinated family members when you are not vaccinated? She's hoping to travel out of state to see her recently fully vaccinated parents.
Yeah, I think that is a fantastic question, and it comes up all the time. You know, Dr. Pate, the one thing, when you're in the ER and an internal medicine doctor comes down and starts talking science, you just kind of sit down or go look for some CPR to do or something. Because, you know, thank you, Dr. Pate. It was fantastic answers. But there's a lot we don't know, right? We just don't know. And one of the things we don't know, Audrey, that's hard for people to understand is everyone's immune response is a little different, right? So my in-laws have been completely quarantined. They're getting the vaccine. Hopefully they're upper 70s. But even between the two of them, their immune response might be different to this first vaccine. So we're going to want to be careful. And the nice thing about it is we know how to be careful. We've been hopefully trained and taught that how this thing transmits. So when we're around them, even once they're vaccinated, boy, I'll tell you, we're going to go visit them now, but we're going to probably be very careful even once we're all vaccinated until we know more. Now, I think what will happen is really smart people and scientists and studies will then tell us, hey, is this immunity lasting? Are people protected? What do we know here in the next 3 to 6 months to 9 months? So David, you probably have a better answer than I do on that. But my recommendation would be to still be careful on those visits. And I would still probably wear a mask and be careful when I'm there with them. But I'm going to go see them probably now. And that's the good thing.
I think that's great, and it's pretty impressive for an ER doc. The one thing I would probably add is, yes, I think people are going to want to go see their family, but understand travel is still very risky right now, even if you're vaccinated. We've got 4 variants of concern circulating in the United States, and I don't know where you'd be traveling to. Now, if you want to hop in your car and drive, across the state to go see someone, I don't have a problem with that. But I would still be very careful about airplanes, other public transportation until we know more. Just like Dr. Ahlquist said, the problem is we do know these vaccines are really beyond our wildest dreams effective against the strains we've been dealing with. But there's a lot of unknowns about these new strains, and I'm very hopeful and I'm very optimistic. I do think that these vaccines are very likely going to protect us from, at least we won't get severe disease and we won't end up in Dr. Ahlquist's emergency room or in the hospital. But it doesn't mean that you can't still catch it or you can't still get it and transmit it to somebody. So just to emphasize Dr. Ahlquist's point, even when you're vaccinated, wear your mask, keep your distance, wash your hands, stay home if you're sick, don't go to big gatherings, all the things we've been talking about until we can really bring this disease under control. And, what we're shooting for is this herd immunity. And people throw out all the numbers about what's that going to be and when that's going to be. Look, I don't know the answer. They don't know the answer. What you do is you follow our statistics. Right now, we've got transmission rates that, depending on where you are, have been 20 to 30 to 40 new daily cases per 100,000. That's not good anywhere in Idaho. But when we get to herd immunity, what will happen is those will all plummet and we'll be down in the 1-2 range, somewhere around there. So follow those numbers. Don't worry about percentages. Don't worry about predicting when this is going to be. Follow the numbers. The numbers will tell us when it's safe. Until then, do everything we've been telling you. Pretend you aren't vaccinated and take the same precautions.
Yeah, great. Thank you so much. I think this will probably be the last question we have time for, but I hope we can hear from you again. When Linda asks, and oh my gosh, everybody wants to know this, when can we expect more vaccines coming to Idaho beyond the current allocation? When are things going to get better? Dr. Ahlquist, do you have any theories?
So I don't have, I'll let David answer the first question because I think he's much more in tune with probably when we're going to get more. But I do know the formula is the more you use, the more you're going to be able to apply for or get. So let's get the ones we have in arms and let's try to do the best we can to be efficient, I would say, and then we're going to get more. I also think, there are things you learn going through the testing curve that we went through. I think you're going to see these crunches and then you're going to see more vaccine. And I think that we're the United States of America, for crying out loud. We're going to figure things out between private industry and health systems and state government and local governments. I think we're going to figure things out. So I don't know the answer, but I would tell people to be hopeful that as long as we do our part to really get our house in order and get those fundamentals in order and start using this virus or using this vaccine, I think you're going to see more vaccines come in and people are going to have more access to it as long as we can clean up our processes. The second thing I'd say is, when are things going to get back to normal? I think we can come out of this better, Audrey. When you go through a trial like this, we should, as a society and as a community and as health systems and as families, hopefully we come out of this better. I try to remind people that all the time. The worst things I've ever been through in my life, whether it was the last recession or personal trials or whatever, come out of it better. And I think that's hopefully what we're doing, is looking at ways to come out of it better. And then if this is the last question, the only thing I'm going to do one more plug. I worry a lot about people that are Spanish speaking. I worry a lot about getting accurate information out there. And I want to let everyone know that at that vaccinate208.com or crushthecurveidaho.com, we're translating all of the information we can into Spanish and making sure that it's going to be easily accessible for those folks to get in and at least understand the processes. Imagine how hard it is to navigate systems for people that have friends that are doctors, let alone people that are so disadvantaged. So we're doing that. And then we're trying to put as much good information as we can there in as simple form as we can so that people can really understand to combat some of the misinformation out there. But with that, I'll let David probably give you the better answer.
Yeah, I don't have a better answer, but I'll just add to it. The things like Dr. Ahlquist said, we need to be hopeful, we need to be optimistic, and there's every reason to be. First of all, the Biden administration just bought another like 300 million doses of vaccines, so that's going to help. The other thing that's going to help is that the Johnson & Johnson or Janssen vaccine is likely going to be reviewed by the FDA at the end of this month. And I think most of us suspect it will get emergency use authorization. And I think it will get emergency use authorization and start being released to us hopefully in March. So that could really increase the vaccine supply as well. And of course, one of the benefits of that one is that's the only vaccine right now that at this time, you only need one shot. And so that can help us move this along further. It's also tremendously easier to store and use. It's more like the regular vaccines that doctors are used to managing. The third thing to be optimistic, because I will say I got really discouraged last month, end of last month, beginning of this month, because we weren't enrolling enough kids in the trials. That has really picked up, and now the Pfizer trial for kids has filled. I'm so grateful because, if you do believe the numbers that are thrown around about for herd immunity, 75, 85%, you know what percent kids are in our state? 23.6. We won't get there without kids. So now that these vaccines are filling up, and let me just thank the parents and the kids who are brave enough to sign up and because I think these are very safe trials, to be part of that, to help everyone. I mean, that's going to make a world of difference. If we can get those vaccine trials done and vaccine approved for the kids by this summer, now we can start to be hopeful about next school year. So I think, again, another reason to be very optimistic about this. And then finally, in reference, Audrey, to your alluding to maybe doing another one of these, I would be all in. And, my favorite part is just listening to an ER doctor try to explain immunology. So it would be a lot of fun. And I hope you do have us come back again.
All right. Thank you so much, both of you, for joining us and talking with us and sharing what you know. And thank you to our viewers for joining us and for asking so many great questions. Idaho Statesman's always here to help try to answer your questions too. You can find more of our COVID-19 coverage at idahostatesman.com/coronavirus. My name is Audrey Dutton, health reporter for the Idaho Statesman. You can support our work covering the pandemic and support community conversations like this by subscribing to the Statesman. All you do is go to idahostatesman.com/subscribe. Have a great afternoon, and thank you so much.